helps with clinical training. He is a full-size simulator that is operated by computer programs. The programs enable instructors to fix parameters and tailor SimMan to fit specific scenarios. SimMan is able to sense chest compressions, pulse checking, ventilation, and defibrillation. A computer operator has the ability to control his responses or to pre-program his reactions. SimMan's features include radial and brachial pulses, femoral and carotid pulses, breath and bowel sounds, heart and corticoff blood pressure sounds. SimMan can even speak.
I'm so sick.
It is possible to insert an NG tube through SimMan's nose. Placement can be verified by auscultation with your stethoscope. You will also be able to observe the rise and fall of SimMan's stomach during ventilation. In the event that SimMan suffers a myocardial infarction, he can even be shocked with up to 360 joules by the defibrillator. For your convenience, SimMan can be set up as a male or female in order to practice Foley insertion skills. There are several places you may use when checking pulses on SimMan. Some pulses are found on his left arm. There are no pulses programmed to his right arm. When checking pulses, you must use a soft touch in all locations except for the carotid area. You may need to press a little harder when feeling the pulses in the neck. The carotid pulses are found on either side of his neck. The radial pulse can be found on the pad located at his left wrist. The brachial pulse pad is located just to the inside of his left elbow. The circular pad on the AC of his left elbow is used to hear the corticoff sounds of blood pressure. Femoral pulses are located at the top of both legs. Pedal pulses are palpable in both extremities. The posterior tibial are found by the interior ankle, and the dorsalis pedis is located on the top of each foot. SimMan's right arm is reserved for IV placement. IVs can be placed on the back of his hand, the right forearm, or the right AC. After placing the IV, it is very important to label the site with date, time, and initials. Prepare your label before placement and remember not to use ink on the SimMan or your patient. The apical pulse can be auscultated by placing a stethoscope over the left side of his chest, just to your right of the sternum. When shocking SimMan during defibrillation, make sure to place the paddles on the corresponding metal connectors. SimMan is a great tool for you to use during your nursing education. Do not be afraid to move or reposition SimMan when practicing skills and patient care. When in the lab, treat him just like your real patient. The best way to learn how to respond in a real-life situation is to go through every step the same way in simulation. This is the place to make errors and fix mistakes without causing harm to the patient.
Thank you.